According to the United Nations, the global life expectancy will reach 77.3 years by 2050. But as people's lifespans actually increase, so does the number of health issues that the aging population faces. Asha AI is a healthcare solution to help elderly patients and their family members monitor the patient's health from home. I speak to the company's founder, Rashmi JOSHI. JOSHI is an entrepreneur based in New York City. I spoke to her at the Consumer Electronics Show in Las Vegas, where she was a speaker. In 2019, JOSHI's grandmother, who was living in India, was diagnosed with cancer. Trying to care for her from a distance became the inspiration for the app. In fact, Asha is named after JOSHI's grandmother, and the word in Sanskrit means hope. So your grandmother's ill.
Yeah.
Family members have got to go to India to try and help out, but they've got obligations back at home. All of a sudden, it's kind of this nightmare. And you kind of came up with your own kind of solutions. Okay, we'll do this, we'll do this. So walk us through kind of the steps before you had the aha moment and said, I'm going to create a company.
We tried 3 or 4 smartphones and tablets. Trying to educate my grandmother how to use them was just an uphill battle. She really couldn't figure it out, and also really didn't have an interest in being able to figure it out. And we also talked about setting up sensor or camera-based equipment in the home. And, there were privacy concerns around that. They felt skittish around that, so we decided to not do that. And then we tried 3 or 4, apps that were on her existing sort of non-smart dumb phone, flip phone, which she's comfortable with. And they really didn't do the job because we had no idea what was actually happening with her health since they didn't use it. And so we went through this sort of cat and mouse game of trying different things, figuring out what worked. None of it really made sense. And so at that point, as I started doing more research and trying to figure out how can it be possible that our healthcare system doesn't have a tool that helps elderly patients who ironically require the most amount of care and attention, but we don't build any tools to help them stay on top of care. So at that point, after doing about 2 years of research, I put my founder hat on and I said, it's time to fix this.
Would you like me to call your doctor?
Through the Asha AI app, patients have access to voice-enabled care, such as instructions about how to take their medications. The app also keeps family members informed about how the patient is doing.
Okay, done. Okay, we'll log that you're feeling unwell in the app.
I think in some respects, while obviously a hardship for you and your family, approaching it that way as a founder is much more beneficial because you understand all the different facets, because it's complicated, isn't it?
It's very complicated. We have such a nuanced healthcare system, especially here in the US. And the way that people consume healthcare as patients, the way that family caregivers are involved, there's so many cultural dynamics at play, and there's so many inefficiencies baked into the healthcare system that you really have to do your diligence and understand it before you throw technology at it. Because technology alone in healthcare won't solve the problem. So one thing I really wanted to focus on with Asha is, let me make sure I really understand the pain points of not just elderly folks and family caregivers, but of clinicians who are involved in helping provide care, of insurance providers who are helping pay for care. All of these different players who are involved in providing care to elderly patients and figuring out how to build a solution that's going to fit within this very nuanced infrastructure and system is very, very important. It's vital because you can build something that's just tech-based and expect people to adopt it, but they won't. If you're trying to inspire a change in behavior, you have to build something that is at least 10 times better than what's on the market. And building something that inspires a change in behavior for the elderly demographic is near impossible. So we focused on building something that was as easy as having a conversation with a loved one.
So let's go back to your grandmother. Asha's in her hands. Give me an idea of just how this works. Like she wakes up in the morning. How does it? I mean, it kind of is all encompassing in some respects. It's like actually having you fly over there and make sure she does all the right things, right?
Something. I mean, that's what we're hoping for. That's the goal. I think obviously there are certain things that you really can't do through an app. So if you require around-the-clock care, which unfortunately at this point my grandmother does, so we have a live-in nurse who's helping manage everything. But prior to that, she was mostly taking care of herself. So let's say she wanted to use Asha, she would basically open up her iPhone and she can just have a conversation with Siri. And Siri will chat on the back end with Asha and provide information through Siri. So she can do things like receive reminders on when to take her medications. If she has questions, like let's say, can I take my pink pill with my red pill? Asha can intelligently answer that by ingesting her health chart. And so if she has any questions as she's going throughout the day, let's say she has a headache, Asha can make sure that she has access to care. And, you know, as she's going through earlier stages of Alzheimer's right now, that might be linked to her Alzheimer's medication, perhaps. So she would route her to, in that case, to either her PCP or whoever the specialist is that's responsible for managing her Alzheimer's treatment. And so she can basically do the non-clinical triaging functions to make sure that patients have access to care as needed. And then there's a whole slew of other lifestyle and wellness related features that we're building. For example, virtual hugs. We lost my grandfather about 6 months ago, and my grandmother has been feeling very isolated and lonely. It's the first time in, I think since she's been 20 years old, that she has been without him. So understandably, she's feeling that deep sense of grief and loss. But being able to chat with Asha, Asha can tell stories, she can tell jokes, she can remind her of some of her favorite memories, which for Alzheimer's patients is such a huge value. She can also do things like send virtual hugs from loved ones, let's say from me or from my mother. And so little things that we can do to help keep that person engaged, and even just raise their spirits sometimes is so valuable. And loneliness is an epidemic when it comes to the elderly population, because there's not a ton of data up until I think 2015 when AARP did this study about how loneliness impacts health. And now we know actually it's a huge factor in deteriorating health for elderly Americans and patients in general.
Loneliness has been linked to several negative health consequences, including a higher risk of developing dementia, depression, and heart disease. The health effects can have the same impact as smoking 15 cigarettes a day, according to the U.S. Surgeon General. What I find interesting about this is your grandmother ends up with the technology, and it's adaptable where somebody who's elderly, because no one likes change,
Yeah.
and especially the elderly people definitely don't like it. So it's something that they can use and they can get familiarized with and actually use, as you said. And you have technology that people don't use. What's the point of it? But that's one feature of this. The other feature, you talked about your mom and about you, it's the peace of mind
Absolutely.
feature. I mean, you're over here, but you feel good that it's almost kind of an extension of you. There, you know that she's being taken care of.
Yeah.
Can you talk to us about that?
Absolutely. So I think most family caregivers, especially if they're going through Alzheimer's treatment or deteriorating cognitive health in their loved ones, will tell you that it's really, really hard to know what's actually happening unless they're calling or physically there with their parents or spouse, right? And it's already such a difficult journey for family caregivers. We wanted to build something that was helping alleviate some of the pain points of coordinating care, let's say with another member of the family, you know, who's picking mom up from her PCP's office, who's picking up her medications. You can coordinate a lot of that through Asha. And you can also go through and see the conversations that your mother had with Asha and what the resulting action items were. So there's a historical log feature that is HIPAA compliant, and you can go through it and see, okay, actually my mother didn't tell me she had a headache for the last 4 days. This is something that could be potentially very important to mention to her physician, right? But fortunately, Asha was able to detect that and also share that information with her clinical team, and then has sent you a notification saying, hey, this is what happened on that call with the clinician. So you get much more insight in terms of what's actually happening. I think that also helps solve for that peace of mind problem for family caregivers.
And that's one of the things that I think maybe you can talk about this. It's different being a founder of a company like this because it's not just got to be patient-centered.
Yeah.
The medical community, they've got to say, oh, I don't like this feature as well, or maybe you should do this and that.
Yeah.
You've got to hit so many different markets in a sense, which makes it a little bit more difficult, more daunting. Talk to us about that.
So we've actually done a pivot in the last 6 months. And we are now focusing the use of our technology on helping pharma companies to run drug trials virtually. And so to date, if you wanted to join clinical research, let's say you have a very rare form of cancer, stage 4, and you found this incredible research study that's on the other side of the world in New York at Memorial Sloan Kettering, and you wouldn't be able to participate in that trial unless you're physically living near one of their clinics to be able to go in, do your registration, share your outcomes every few weeks or every few months. So pharma historically has had a really difficult time recruiting a diverse patient population into their trials. So they're making medicines for a very small percentage of the patient population today. And so what happens is once that drug hits the commercial market, they're learning, actually, this isn't working that well for Asian Americans. It's not working that well for patients who have diabetes. And so, there's so much that we can do to get access to patients who are bedridden, patients who maybe are undergoing really intense chemotherapy and can't make it out of the house, patients with disabilities who are elderly. Imagine if you could join any clinical trial in the world from the comfort of your couch. That's what we're trying to accomplish through Asha. And so making trials, making life-saving clinical research available to anyone, no matter if they're elderly or disabled or in a wheelchair or going through cognitive decline or not socioeconomically empowered enough to be able to afford traveling in and out of New York City. It's a huge and very powerful message, and it's a tool that is going to help us build better drugs, better medicines for all of us.
As the use of AI expands in healthcare, patients have mixed views. According to a Pew Research Center survey, 60% of Americans said they would be uncomfortable with their doctor relying on AI, although 38% say they believe the use of AI would lead to better health outcomes. Where do you see the future going, or is it kind of going to decide itself where it goes?
I think that the way that our healthcare system is set up right now is going to change completely. And the reason I say that is because today, if you go into your PCP's office, your clinician is expected to remember everything they've learned throughout the course of their medical education at the drop of a hat. And I actually don't think that doctors or humans in general are the best methodology for diagnosing patients. So I see AI being the primary modality for diagnosing patients in the future. And with the influence of things like surgical bots, I think we'll also see them starting to treat patients as well. So I think the healthcare system is going to evolve to be largely AI dominant. And we might have a human in the loop, a physician here or there, just for liability purposes, because we want to be able to point the finger at someone when things don't go as planned. But on the whole, I think AI is going to be diagnosing patients, treating patients, and we should be able to receive care at home. And I think Asha is going to bridge the gap between people being able to access care in the comfort of their own home and where we are today.
Being an entrepreneur, you're creating businesses and coming up with these creative ideas and all of that. But in the space you're in now, it's about life and death. How's that changed you?
I think it's just deeply meaningful work, and there's such a gravity to the work that we do at Asha that is important to note, because everything that we build, we have to make sure that we're making decisions accurately. And so you can't just throw something on top of ChatGPT and call it good when you're dealing with people's health. You have to be able to really understand the implications of your actions and the implications of the actions of your AI. And so I think building Asha has been a much more nuanced, detailed, deeper diligence process than I've had for any other company that I've been a part of.
A final question. I guess when you are kind of creating, it's conceptual, but when you see it in the hands of your grandmother, it's much more than that. And that's kind of, I imagine, it drives you even more, I would think.
Yeah, I think seeing the user stories, watching people actually get value out of what we've built, that is the best part of my job and my day. And seeing that actually come to fruition, that you've built something that is adding that kind of value, that's helping change people's lives for the better. There's no other better feeling in the world than that.
That's amazing. Well, congratulations on where you are, and we'll keep our eye on you. I'm sure better things are ahead because it's really important what you're doing.
Yeah, I think so. Thank you very much.